Hey Treasure Valley, it's Katy Connley, owner of Treasure Valley Metabolic Medicine and nurse practitioner. So the thing I wanted to talk about today is ketogenic eating and the ketogenic diet. So obviously super popular type of eating right now, what you could sometimes consider fad dieting. Everybody knows that it initially started as a treatment for epilepsy, but other people, especially the insulin resistant, carbohydrate sensitive, have found it really useful for weight and blood sugar management. So to start out, essentially ketogenic eating, again, most people have a pretty decent knowledge of this, but high fat, moderate protein, and very low carbohydrate, meaning usually it's 20-25 net carbs, meaning we subtract the fiber out. The reason why we do that is because the ways that fiber works is that it doesn't necessarily elevate blood sugar in that form. So we can subtract out some of the fiber that we get with like some of our fruits and vegetables. However, again, in keto, we're not really eating a whole lot of fruit, usually berries, blueberries, that type of thing. So really low net carbs in those. Can be really useful, and we do use it in patients at times that we feel like it would be really helpful for them to sort of kickstart weight loss, or if patients are interested in it at all and they want some support with it, we're absolutely willing and helping you do that. I don't necessarily directly go to ketogenic eating for every single patient. The reason why is because as most people have kind of identified, is for some people it can be really challenging to sustain long term. It is very different from our standard American diet, which tends to be higher in carbohydrate, higher in fat, and lower in protein. So it just tends to be harder to kind of keep going at it long term. The place where ketogenic eating can be really useful is in patients that are incredibly insulin resistant. So patients that are on that metabolic pathway, like we've talked about in previous videos, are essentially carbohydrate intolerant. So if the pancreas, which is the organ that secretes insulin, which lowers blood sugar, if that doesn't work very well, you're essentially carbohydrate intolerant and your body can't process or get that carbohydrate to where it's supposed to go. What ends up happening is insulin forces that carbohydrate into the cell and forces it to either be burned as energy or get stored as fat tissue. And obviously we don't want to do that. So ketogenic eating can be really nice for that because it essentially takes away the food process that doesn't really work well for you, being insulin resistant. Again, doesn't mean that everybody has to do that when they're insulin resistant or have diabetes. However, it can be a really useful tool to get blood sugars under control. And there are many other people that are in the diabetes endocrinology field that really feel like it's an incredibly important thing to do. The other way, of course, is obviously fat burning, using fat as energy, which is that byproduct ketones. So your body essentially becomes what we consider fat adapted and uses that fat tissue as energy. The really nice thing with this is that it learns how to prioritize that. So the mitochondria in the cell can either burn glucose or it can burn ketones. What we call, when we're fat adaptive, we can kind of be really fluid in those two and go back and forth a lot easier. So it's really useful when we can do that and our body prioritizes burning fat, because obviously if we have excess fat tissue, we want it to really be good at that. So it's an easier way to do that in that metabolic process. So that's kind of a brief overview. Again, super quick, down and dirty piece of that. There's a lot of other things that have to do with ketogenic eating that needs to be monitored by a medical professional. I do not encourage patients to do keto on their own because it is really specific. There's a lot of issues with not adequate amounts of protein that can cause muscle breakdown. And there's also lots of issues with electrolyte imbalance. So you really need to be seeing a medical professional to help with that. If you have any other questions or want to schedule an appointment with myself or my registered dietitian, Kirsten Thomas, please call Treasure Valley Metabolic Medicine at 208-274-9580 or visit us at tvmetabolic.com. Thanks.